Good afternoon, everyone. We'll just give it a few minutes here as people are coming into the room. And we still have people coming in, so we'll just wait a couple minutes longer. Okay, and thank you all for introducing yourselves in the chat while we're waiting as people are coming into the room. Okay, we'll go ahead and get started. Hello, everyone, and welcome to the Turning Resources into Action, Increasing Integrated Housing Options for People with Intellectual and Developmental Disabilities webinar, produced in partnership with the Administration for Community Living, Administration on Disabilities, and the Housing and Services Resource Center. My name is Lori Gerhard. I'm the Director of the Office of Interagency Innovation at the U.S. Administration for Community Living, an agency within the U.S. Department of Health and Human Services. I will be serving as the facilitator for today's webinar. It's a privilege to have so many of you here with us today. Before we get started, I'd like to cover a few housekeeping items. This meeting is being recorded. By staying to participate, you are consenting to the recording. Also, all attendees' microphones have been muted for audio quality. One hallmark of our webinars is active participation from attendees, like you're doing right now, sharing your name and your organization in the chat. Please frequently use the chat to make comments and submit your questions anytime in the Q&A feature in the Zoom dashboard. You may also email a question or comment to the Housing and Services Resource Center mailbox at hsrc@acl.hhs.gov. We have reserved time to address your questions at the end of the session. You can also use the chat or email if you have a technical issue. Safe, accessible, and affordable integrated housing options for people with intellectual and developmental disabilities are extremely limited. As a result, almost 70% of adults with intellectual and developmental disabilities live with their families, and most who live outside the family home live in group settings. To improve and expand community living options for people with intellectual and developmental disabilities, we are hosting a 3-part webinar series that explores the housing needs of people with intellectual and developmental disabilities, the barriers they face in securing housing, including a limited inventory, and innovative strategies, resources, partners, and funding streams to help create more integrated housing options for people with intellectual and developmental disabilities. The first webinar, Community Living Housing Options for People with Intellectual and Developmental Disabilities, Perspective on Barriers and Solutions, included an overview of the experiences people encounter when seeking housing, an overview of data from the Residential Information Systems Project Annual Report, Status and Trends through 2019, and state systems and structures to serve people with intellectual and developmental disabilities. This webinar was recorded and can be viewed by visiting the HSRC website, What's New page, under Prior Events and Webinars. A link to the prior webinar will also be provided in the chat. Today's webinar, Turning Resources into Action, Increasing Integrated Housing Options for People with Intellectual and Developmental Disabilities is the second webinar in the series. Next slide. The webinar will include an overview of federal resources for increasing integrated housing options for people with intellectual and developmental disabilities. We'll learn how Arizona has turned federal resources into action, and we'll also hear firsthand from Mr. Anderson Moore about his experience and learn what successful housing options look like. Next slide. I'd like to share some information about the Housing and Services Resource Center. ACL works in partnership with the U.S. Department of Housing and Urban Development, also known as HUD, H-U-D, the Centers for Medicare and Medicaid Services, CMS, the Substance Abuse and Mental Health Services Administration, SAMHSA or SAMHSA, the U.S. Department of Health and Human Services Assistant Secretary for Planning and Evaluation, ASPE or ASPE, the Administration for Children and Families, ACF, and the Centers for Disease Control and Prevention, CDC, and recently the U.S. Department of Agriculture, USDA, to administer the Housing and Services Resource Center. The Housing and Services Resource Center brings together federal agencies and our technical assistance providers to cultivate, strengthen, and support cross-sector partnerships in communities, states, and across the federal government that bring together housing, homelessness services, aging and disability services, health, including physical health, behavioral health, and mental health, and public health services. Every state and community has a number of agencies, organizations, and programs helping people access housing and supportive services, but the housing and service systems often are siloed. Stronger collaborations between these systems would enable more people with disabilities, older adults, and people experiencing homelessness to achieve housing stability, live with dignity and independence in the community, and avoid homelessness and costly institutional care. Thank you for joining us today to learn more about federal resources and successful housing options for people with intellectual and developmental disabilities. Next slide. I'd like to introduce Allison Barkoff. Allison is the U.S. Administration on Community Living, or ACL, Acting Administrator and Assistant Secretary of Aging and Principal Deputy Administrator and she will provide opening remarks. Please join me in welcoming Allison. Allison?
Thank you so much, Lori, for that introduction. And I am really excited about this webinar series focused on affordable and accessible housing options for people with intellectual and developmental disabilities. I am just so excited seeing everyone putting their names in the chat and really the diversity of all of the different types of people who are participating in the webinar today. I see people from state government, people from housing agencies, people with intellectual and developmental disabilities themselves, family members, providers, and we are so excited to welcome you to today's webinar. At the Administration for Community Living, we are committed to ensuring that all people, regardless of age or type of disability, have the opportunity to fully participate in their community. And of course, where you live is key to making that opportunity reality. For too long, people with IDD have had limited housing choices. As Lori mentioned, the vast majority of people with IDD, more than 70%, live with families, and many of those families have aging parents in them. And as Lori also mentioned, most people who live somewhere other than their family home live in congregate settings like group homes. But this isn't what most people with IDD want. A groundbreaking 2019 report called There's No Place Like Home, a national housing study, looked at the housing preferences of people with IDD and their families. And frankly, the report validated what we have been hearing so long from people with IDD themselves. They don't have housing choices, and in most cases, the housing where they live is not their preference. The majority of people surveyed said that where they lived was the only option they were given. Think about that, not being given a choice about where to live. They were also asked about what they would want if they could choose any home. And guess what? Like so many other things, it was similar to what any of us would say. They want their home to be one that they own or rent. They want their home to help them be integrated and valued members in their community, not to be quote unquote facility residents. They want to choose with whom they live and to have their own space and not be forced to share a room with someone they didn't pick. They want their home to be in a safe neighborhood that's near transportation, groceries, and other amenities, and they want their home to be accessible to them. So think about these descriptions. Where people with IDD are living is nearly the opposite of where they want to be living. And at the same time, things are starting to change. In my own family, my adult brother with Down syndrome lives in his own apartment with a roommate of his choice. It's in a neighborhood near my family, walking distance to transportation, and near his job. He has become friends with his neighbors and has friends over to visit him in his place. And of course, he's able to be successful because he has access to home and community-based services that come to him in his own home to help him be independent. There are great models out there, and that's what this webinar series is about. We want to highlight these models to show what's possible and together start bringing these models to scale. This webinar series and the types of partnerships that you'll hear about today between housing and service and disability agencies highlighted in these webinars is meant to be a catalyst to change the stubborn issue of a lack of housing choices for people with IDD. We have a lot of work to do together to make sure that all people have real choices for how to live and fully participate in their communities. As Lori mentioned, today's focus is on how federal programs and resources can be used to move the needle and to make the dreams of people with IDD a reality. I truly want to thank our federal partners for their partnership. And with that, I will turn it back over to Lori.
Thank you, Allison. I'd like to introduce our speakers in the order they will present today. So our first speaker is Martha Egan. Martha is a technical director in the Division of Community Systems Transformation, Disabled and Elderly Health Programs Group, Center for Medicaid and CHIP Services, Centers for Medicare and Medicaid Services, and CMS. And our next speaker after Martha will be Lisa Kaufman. Lisa is a senior advisor in the Office of the Deputy Assistant Secretary for Special Needs at the U.S. Department of Housing and Urban Development, or HUD. Our next speaker after Lisa will be Doug Rice. Doug is a senior housing program specialist in the Housing Voucher Management and Operations Division at the U.S. Department of Housing and Urban Development, or HUD. And our next speaker after Doug will be Katina Washington. Katina is a branch chief, grants and new funding in the Assisted Housing Oversight Division in the U.S. Department of Housing and Urban Development. And after Katina, we'll get to hear from Megan Akins. Megan works in the Office of Individual and Family Affairs in the Division of Developmental Disabilities in the Arizona Department of Economic Security. And Mr. Anderson Moore, who is a person who will share what successful housing options look like. And our colleague, Erica McFadden, will facilitate the question and answer session. Erica leads the Office of Independent Living Programs at the U.S. Administration for Community Living. I'll turn the webinar over to Ms. Martha Egan. Martha?
Thanks, Lori. Can you hear me fine? Yep. Hi, everybody. Again, my name is Martha Egan, and I'm from the Centers for Medicare and Medicaid Services. And we are really excited to be part of this webinar series today. And I do want to just start off by saying that, CMS really does recognize that access to affordable and accessible housing opportunities and high quality home and community-based services, or HCBS, these are really dependent on strong partnerships and the ability of these partnerships to coordinate resources at the local, state, and federal level. So really, no one agency or organization or program or provider can do all of the work that's needed to increase access to affordable and accessible housing. So we are really happy here today to talk about what role Medicaid can play in these partnerships, And what I'm going to do is start with a very brief discussion around home and community-based services, including a brief overview of the types of activities that Medicaid can cover to help Medicaid beneficiaries to obtain and maintain affordable and accessible housing. And then I'm going to talk about 2 current HCBS initiatives under the Medicaid program that are providing opportunities for state Medicaid agencies to collaborate and partner with state and local housing agencies and organizations to increase affordable and accessible housing opportunities that really are non-disability specific opportunities. So next slide, please. So home and community-based services. So again, as a quick reminder, these are optional Medicaid services. So states do choose from a very broad array of services to put together their packages of HCBS. And for the purposes of today's discussion, I'm really just going to focus on the types of housing-related services and supports that can be covered under the Medicaid program. So CMS does continually partner with states to find pathways under the Medicaid program to cover services and supports that can assist Medicaid beneficiaries with obtaining and maintaining housing. And I do want to direct you to one resource that I think will be very helpful. In 2021, CMS did issue or released a state health official letter, a show letter on the social determinants of health. And in this letter, there is a description, and we do describe opportunities to cover housing related supports under the Medicaid program. And this would include under state plan benefits, HCBS waiver programs, managed care, and Section 1115 demonstrations, among others. So again, I encourage you to look at that resource. There's a link to it in my last slide that will give you more detailed information on ways and pathways under the Medicaid program. But a few things to point out when we talk about Medicaid and housing. One is that Medicaid does not cover room and board, except in certain medical institutions. And also, housing-related services and supports must be medically appropriate and documented in a person-centered care plan. And then also, housing-related services and supports must be the choice of the beneficiary who can opt out at any time. So we just want to make sure when we talk about Medicaid and housing that you keep those 3 things in mind. So generally under the Medicaid program and under certain Medicaid authorities, housing-related supports and services can include things like one-time moving costs, such as a security deposit, pre-tenancy supports, which can include activities such as assisting with the housing search, tenancy supports, which can help an individual to maintain housing, and home accessibility supports, which can include things like installing a wheelchair accessible ramp. But Medicaid can also be a key and integral part of a collaboration with other community-based programs, including state and local housing agencies. So we really do want to emphasize that CMS really does recognize that partnerships with state and local housing agencies are essential to success in the implementation of coverable housing-related services and supports under Medicaid programs. And there are just various and numerous ways that Medicaid can partner with state and local housing agencies. Just real quick, they can certainly work on developing formal and informal agreements and working relationships. They can participate and contribute to the planning processes of state and local housing and community development agencies. They can certainly coordinate with referral or tracking systems. And of course, Medicaid can always bring to the partnership table the provision of services and supports to assist Medicaid beneficiaries with obtaining and maintaining housing. So let's go to the next slide, please. Okay, so we're going to talk about 2 current HCBS initiatives under the Medicaid program that really can provide opportunities to increase access to affordable and accessible housing, and also opportunities for states to advance these health and housing partnerships and collaborations. And the first one is Section 9817 of the American Rescue Plan Act of 2021. And I'll refer to that as the ARP. And under the ARP, there was an estimated $13 billion provided to states' HCBS systems through what was a 10 percentage point increase to the federal medical assistance percentage, or FMAP, that states can receive for certain Medicaid HCBS expenditures. And this increase did occur during a 1-year period, April 1, 2021 through March 31st, 2022. and states now have available the next 3 years through March 31st, 2025 to spend that increased amount, that bump that they received, and they must spend that amount on activities to enhance, expand, or strengthen HCBS. And so therein lies, the opportunity that we want to make sure that we share with you today. So under Section 9817, states are currently implementing numerous initiatives and activities and programs that are designed to enhance and strengthen their HCBS systems. And this does include housing related activities. Now, again, states can't use this funding for room and board, but states are using it to build Medicaid housing partnerships. Some states are using the funding to provide housing related supports and to implement other allowable activities that can help to address the housing needs of people receiving home and community-based services. And one thing that we're really excited about is that some states are using the funds for capital investments, including to expand access to affordable and accessible housing and to non-disability specific settings as part of a state's HCBS option. So for example, grants or loans to explore, encourage, or build affordable housing and capital financing for affordable housing development are permissible if the funding is to support the expansion or establishment of settings that comply with HCBS regulations. And again, such expenditures are not room and board costs, but are capital investments to increase the capacity of settings that further community living and integration. Several states are using the ARP funds specifically targeted at increasing non-disability specific housing opportunities for individuals with an intellectual or developmental disability. For example, Washington State is developing and providing housing for individuals with an intellectual or developmental disability through a housing trust fund program. Connecticut is coordinating supports in collaboration with their sister agencies and their Medicaid program to expand supportive housing models that are integrated in the community and promote a high level of independence for individuals with an intellectual disability. And several states are using ARP funds to provide new or enhanced housing related services to help people with an intellectual or developmental disability transition to more integrated settings. So again, to note, states have until March 31st, 2025 to expend all of the ARP funds, and they may continue to add new activities until the funds are fully spent. So that is 9817 in a nutshell, and let's move on to the next slide, please. So the other opportunity that I wanted to talk about real quickly is the Money Follows the Person demonstration. This is a long-standing grant-funded demonstration that helps states to rebalance their long-term services systems, their LTSS systems, and support people who are in institutional settings like nursing homes or intermediate care facilities to move back to the community. And in January of this year, funding for the MFP program was reauthorized under the Consolidated Appropriations Act of 2023, and it has extended funding through 2027. So the demonstration will continue to be around for some time and can have an impact on supporting innovative strategies to increase integrated community living opportunities for individuals with an intellectual or developmental disability and other populations. So MFP demonstrations, they can use grant funding to build and implement programs with comprehensive transition coordination services that do include housing related supports and to work on strategies to develop and strengthen partnerships with state and local housing entities. And one way that we CMS are supporting the strengthening of housing partnerships under MFP is through a new effort that expanded the scope and definition of what we call a supplemental service under the MFP demonstration. These are services that are not covered under the Medicaid program, but that are intended to address barriers to transition. And a persistent and longstanding barrier for the MFP demonstrations has been access to affordable and accessible housing. So under the changes to the supplemental services, states can now receive 100% grant funding to cover short-term rental assistance and to cover services that can assist with securing a community-based home, such as paying their application fees, as well as some other services. This expanded service definition is really intended to be a lever or a tool for MFP demonstrations to use when partnering with state or local housing entities. And there are multiple ways that states have leveraged the MFP demonstration to assist individuals to move into community integrated housing, and certainly including individuals with an intellectual or developmental disability. For a quick example, there were many MFP states formed partnerships and collaboration structures to participate in the 811 Project Rental Assistance Program. And this program did provide affordable and accessible and integrated housing opportunities for people with a disability under the age of 62. MFP programs have used grant funding to hire housing specialists who have expertise and practice and knowledge with affordable housing programs to develop and strengthen Medicaid and housing partnerships. And MFP demonstrations have also used grant funding to provide more enhanced housing-related supports that are effective at overcoming barriers to accessing housing for individuals transitioning from institutional settings. One thing I want to note here, we will be issuing an MFP best practices report. This was requested by Congress under the Consolidated Appropriations Act of 2021 in the very near future. This report will include several examples of how MFP states are advancing innovative strategies to provide housing-related supports to individuals transitioning from institutional settings, to address any gaps in the housing services and supports that can be covered under their MFP programs, and also examples of ways to build stronger and more effective housing partnerships. So that is MFP, the MFP opportunity in a nutshell. And let's move to the next slide real quick. So this is just a list of some of the resources that I touched on today. The links are here in the slide, and for the sake of time, I am going to hand it over to Lisa Kaufman at HUD.
Thanks, Martha. Hi, everyone. Hope you all can hear me and see me. My name is Lisa Kaufman, and I am a senior advisor at the Office of the Deputy Assistant Secretary for Special Needs at the U.S. Department of Housing and Urban Development. So next slide, please. So before I get into the homeless programs, I just want to talk for a minute about HUD's mission. HUD's mission is to create sustainable, inclusive communities and quality, affordable homes for all. So I'm excited to be here today to share with you all some information about HUD's homeless assistance programs and how communities, states, localities, nonprofits can tap into these programs to be a resource for people with intellectual and developmental disabilities who are also experiencing homelessness and housing instability. And also glad that my colleagues from HUD, Doug and Katina, are on to also talk more about their programs. So I want to share some high-level information for you all on the universe of homeless assistance programs that are available through HUD's Office of Special Needs Programs. And then I will dive a little bit deeper into the Continuum of Care program after I provide you with some general information. So the Continuum of Care program is a national competition. Projects are ranked and awarded as part of a community process also called the COC. So program components under this program include permanent supportive housing, include rapid rehousing, and supportive services. And in fiscal year 2022, there was $2.8 billion allocated to HUD to make available to communities through this program. The Emergency Solutions Grants program is a formula program, so it's not a competition. So that money is distributed every year to states and localities, and then they can in turn grant those programs to subrecipients, which are nonprofits and other agencies to develop programs. So the programs that can be funded under the Emergency Solutions Grants program include street outreach for people who are experiencing unsheltered homelessness, emergency shelter. ESG funds can pay for homeless shelters, emergency shelters, overnight shelters for people who don't have any place to go. Emergency Solutions Grants programs can also do homelessness prevention to provide rental assistance for folks so that folks aren't experiencing homelessness. And then there's also some administrative activities as well under ESG. So in 2020, through the CARES Act, there were funds awarded to help communities respond to and prevent COVID, to prevent the coronavirus. And ESG, the ESG CV program was funded under the CARES Act. So there was $3.96 billion awarded for ESG CV. And the same program components that I mentioned a minute ago are funded under that program, and 100% of the funds have to be expended by September 30th, 2023. So many of your communities that received ESG CV funds are wrapping up activities because they have to make sure to spend those funds. There's also a youth homelessness demonstration program. It's targeted towards communities that are working in partnership with young people experiencing homelessness to develop a coordinated community response to prevent youth homelessness. And when we talk about youth under this program, we're meaning folks from the ages of 16 to 24. And since 2016, HUD has awarded over $368 million to 94 communities working to prevent youth homelessness throughout the country. So next slide, please. So the last two programs I want to highlight are programs in our Office of HIV/AIDS Housing. The Housing Opportunities for Persons with AIDS program, also known as HOPWA. This is also a formula program that is awarded to cities and states to provide housing assistance and supportive services for low-income people with HIV/AIDS and their families. So that's the eligible population for HOPWA. You have to be a low-income person, and you also have to be living with HIV and AIDS in order to receive funding under the HOPWA program. And there was CARES Act HOPWA dollars awarded also in 2020, about $65 million went to communities. And there's a 3-year period of performance for the HOPWA CV funds. So next slide, please. So as I mentioned, I want to talk a little bit broadly around the Continuum of Care program, and I may try to go through these slides quickly because there's so much great information, and we really want to hear from the folks from Arizona, but want to talk with you all about the Continuum of Care program because it may be a resource that you are interested in tapping into if you are working with people with intellectual and developmental disabilities who are either homeless and or experiencing housing instability, or if you are a person yourself living with intellectual and developmental disabilities and find yourself in need of some homeless assistance. So the COC, as I mentioned, the COC program, the COC is a regional and a local planning body that coordinates services and housing funding for homeless individuals and families. It's structured to promote community-wide planning and the strategic use of resources to address homelessness and to improve coordination and integration with other mainstream resources and other programs targeted to people experiencing homelessness. And this is really important because the COCs are located all over the country, and because they work locally to address the housing and services needs for people experiencing homelessness in their community, it's important that there are all types of agencies that are connected in this process. So not only housing and homeless agencies, not only service providers, but advocacy groups, centers for independent living, behavioral health, mental health. It's important that all of these players are connected so that there is a coordinated response to homelessness, because we know people need access to housing and services. So it's important that we're able to weave these two areas together. So next slide, please. So the Continuum of Care process, how it works is, I mentioned, HUD awards money to the COCs, and then COCs select individual projects to do the programs locally. So that's also another reason why it's important that a COC is made up of diverse stakeholders in the community so that folks have a voice and can weigh in on the projects that are receiving funding locally. Next slide, please. So I wanted to just sort of show you how the funds are awarded and the types of activities that the projects can do locally. There's permanent housing. Projects can fund community-based housing without a limit on the length of stay. There's transitional housing, which is time-limited housing and supportive services. And the goal for transitional housing is to move folks to permanent housing within 24 months. And then there are other eligible activities. There's supportive services, and there's data under our homelessness management information system, and then homeless prevention activities. So next slide, please. And my apologies if it seems like I'm going through these slides fast, and it is because there's a lot of great information, and it is my understanding that you all will get these slides. So I've also put some resources in there that you can tap into after this presentation. So I talked for a minute about the Continuum of Care program and the types of activities that it can fund. So I just want to share really quickly the types of things that the Emergency Solutions Grants program can pay for. I mentioned it can pay for street outreach, right? So for programs that are doing street outreach to go out and reach people who are unsheltered, to help them with case management, with supportive services, and to get them connected to housing opportunities. ESG can pay for that. I mentioned ESG can pay for an emergency shelter, can pay to renovate a building to become an emergency shelter, and it can also pay for those essential services and the shelter operations that happen within the shelter. So the staffing, the food, all of the costs that you would need to run an emergency shelter can be paid for under this program. In addition, homelessness prevention is eligible under ESG. So that's short, medium-term rental assistance that could be provided to a household because they've experienced perhaps a loss of income, or there's just some situation where folks need a couple of months of rental assistance to get them to either a new job or until benefits kick in. This homelessness prevention is key because it keeps people in their units so that folks aren't made homeless and do not have to come into the homeless system. Next slide, please. So I also talked about the Youth Homelessness Demonstration Program. This program can also fund transitional housing to work with young people up to 24 months to get them to move to more permanent housing. It can fund permanent housing. It can pay for supportive services, that case management, those services that young people may need to get them to be connected to permanent housing. Some of the types of housing we've seen delivered under the Youth Homelessness Demonstration Program includes host homes, where there are young people who are by their choice in a home where there's like a host family, and they come together in a community. There's also some shared housing where people have roommates. Once again, this is also by their choice. And then there's some planning dollars that's available to community to help them ramp up to develop these activities. And next slide, please. And then under HOPWA, the Housing Opportunities for Persons with AIDS, some of the same programs, the activities are eligible that I've mentioned before. There's short-term rental assistance, some rent to help people to prevent homelessness. There's permanent housing. There's supportive services that can also be funded under the HOPWA program. So next slide, please. So how do you get connected to these programs, right? If you're interested as an agency, you want to learn more about how do I get connected to my COC, or if you're a service provider, there's someone that I work with and that I'm advocating on behalf of or with, I'd like to get connected. I'm a person with an intellectual and developmental disability, or I'm a parent. How do I get connected to these programs locally? We have a website called the HUD Exchange, and you can go to the HUD Exchange and then select your state, and it will give you a listing of programs in your area that you can then contact for more information. Next slide, please. In addition to the HUD Exchange, you can also submit a question, right? If the website is a challenge to navigate, if you're not quite sure, you can submit a question to the HUD Exchange, get assistance / my question, and say to them, hey, I'm someone that lives in Des Moines and I want to get connected to my local HOPWA program, or I want to get connected to my local COC. I can't find it on the website. Can you give me that name and address? And then they will respond to you and get you the local contact so that you can reach out to them and hopefully access these programs on your behalf or on behalf of people that you work with and or advocate. So thank you all for having me. I hope this information was helpful. I'll be monitoring the chat and the Q&A, and I am happy to turn it over to my colleague, Doug. Thank you all so much.
Hi, everyone. Again, I'm Doug Rice. I'm a policy advisor in HUD's Office of Public and Indian Housing Programs. And I'm here to provide a quick overview of the largest and most flexible federal rental assistance program for low-income households, the Housing Choice Voucher Program, and with a particular focus on one part of the voucher program that we call mainstream vouchers. Next slide, please. So first, just some general background. Who uses housing vouchers? Well, there's about 5 million people and 2.4 million households that are using housing vouchers right now. And this chart shows a very basic demographic breakdown of these households. As you'll note, about 25% of the households are headed by someone who's a non-elderly person with a disability. However, a large share of the households under the older adults category here also are people with disabilities. And when you add all those up, about 45% of the assisted households, either the head or the spouse or another adult in the household has a disability. So this is a major, far and away the largest source of rental assistance for people with disabilities. Next slide, please. Housing vouchers are very flexible. The program is administered jointly by HUD and some 2,100 state and local housing authorities around the country. Eligible households, they receive a voucher and they use them to rent available private market units. There's a lease between the tenant and the owner, and then there's a housing assistance contract that has to be executed between the local housing authority and the owner as well. Vouchers are portable, which increases people's choices of both housing and neighborhood locations. A share of housing vouchers may be what we call project-based, that is tied to specific housing units in developments such as supportive housing developments. Housing vouchers may be used for shared housing arrangements, living jointly either with households that are other households that are assisted or unassisted. And it's also allowable under the voucher program to have a live-in aid for people with disabilities who need an aid is a reasonable accommodation. Next slide, please. Okay, so there really are several voucher programs. All of them largely operate under the same rules, but there are some smaller programs within the general overarching program that have slightly different rules as well. And this is a partial table showing some of these smaller programs and just kind of moving from the bottom here. So there's the Emergency Housing Voucher Program, which was created with money from the American Rescue Plan. That's 70,000 vouchers out there. Those may be used only by people who are experiencing homelessness or at risk of homelessness or fleeing domestic violence. There's the the VA HUD supportive housing program, which is for homeless veterans. There's the non-elderly disabled housing program, which is a program that was created in the 1990s, basically to provide housing options for certain public housing residents in developments that were being converted from 100% people with disabilities to 100% seniors. And so these vouchers were made available. Congress has not provided any new money for NED vouchers in quite some time. And then there's mainstream vouchers, which is what I'm going to spend the rest of the time talking about. There's almost 70,000 of those. Those are for non-elderly people with disabilities. Next slide, please. So the mainstream voucher program was also created in the 1990s, and these are pretty much regular housing vouchers with a few twists. Only non-elderly people with disabilities are eligible for these vouchers. But as I said, they pretty much follow the rules of the general voucher program. Funding for these vouchers and financial reporting for these vouchers is separate from the regular voucher program. Next slide, please. And a bit about recent funding allocations for mainstream vouchers. So there was a major expansion in mainstream vouchers 5 or 6 years ago. Congress appropriated $500 million in new funding for new mainstream vouchers over several years. And HUD issued notices of funding availability in 2018 and 2019, and also made some non-competitive awards in later years, awarding some 56,000 new mainstream vouchers overall during this period. And in the list, there's a link here in this bullet that will take you to list of PHA's awards, Housing Authority awards of mainstream vouchers, and other data as well. The housing authorities that administer mainstream vouchers are still working to distribute some of these new mainstreams that they've received. As you may have gathered from the table above, of the 69,000 mainstream vouchers that are out there, about 17,000 of those remain unleased. And those are vouchers that agencies have funds to allocate, but they're working with their partners to find eligible households to use them. Next slide, please. So I wanted to say a bit about the awards and the criteria that HUD used in awarding these mainstream vouchers that HUD has awarded in recent years. Basically, HUD has strongly incentivized housing authorities to create partnerships with Medicaid agencies, with homeless service providers, other kinds of service providers who work with people with disabilities in their communities, to ensure that when partly to help identify eligible people to use these vouchers, but also to help ensure that when they receive a voucher, they are also more likely to be connected to the kinds of supportive services that they may need to be successful as independent tenants. And so this is just a quick summary. When we allocated the money, we took into account various factors to achieve these goals. One, we were looking for agencies that already had experience working with people with disabilities, as well as established partnerships with Medicaid agencies, homeless service providers, other health and human services agencies. There was also priority on housing authorities that had established preferences, which is a prioritization for allocating vouchers for people transitioning out of institutional or other segregated settings, who are at risk of institutionalization, experiencing homelessness or at risk of homelessness, and so on, as well as a demonstrated ability to connect assisted households with housing and community-based services. And then there was a program evaluation and improvement component as well. Okay, next slide, please. And here's some links to resources on mainstream vouchers, in particular, a link to our main page, for mainstreams. There's also a link to one of the recent major notices that explains updated policies and procedures for using mainstream vouchers on HUD Exchange, which is a website that Lisa mentioned earlier. There's also detailed topic guides on mainstream vouchers that provide a wide range of background information. And we have a dedicated email address too. If you have any questions about mainstream vouchers, you can send those questions to this address here. The last thing I'll mention is that, as I hope was clear earlier, your best state and local contact for mainstream vouchers or housing vouchers generally is your state or local housing authority. And I didn't include that here, but if you Google HUD PHA list, you will easily find the list of state and local housing authorities that can provide you with information on the voucher program. And I'd be happy to answer questions later, and on to the next presentation. Thank you.
Thank you, Doug. My name is Katina Washington. I'm a branch chief in the Office of Multifamily Housing Programs. I'm going to cover grant programs in the Office of Multifamily Housing. Our programs are slightly smaller than the voucher programs, but they still have the same purpose as in serving persons with disabilities. I'm going to briefly walk through the purpose of the program, the goals and a snapshot of the program, and the two programs that are available under the Section 811 program, and how to access those programs. Next slide. The Section 811 program was authorized in 1990 to create housing specifically for persons with disabilities to live independently as possible in the community by providing affordable rental housing opportunities with access to the appropriate supportive services. The program aims to provide permanent supportive housing for non-elderly persons with disabilities an integrated environment, encouraging partnerships with state and local agencies. The program aims to target not only persons with disabilities, but those with disabilities who are unhoused, living in institutions, and states with settlement agreements. Next slide. The goals of the program is to provide persons with disability with meaningful housing and health and long-term supports and services. We aim to, under this program, fund, innovative, effective models that are at the forefront of housing design and service delivery. We encourage formal partnerships with health and human service agencies or local service agencies to coordinate voluntary services and support to enable residents to live independently in the community. Next slide. The Section 811 supportive housing for persons with disability offers two distinct programs. We have our Section 811 Capital Advance Program, which we refer to as the traditional program, and our Section 811 Project Rental Assistance Program, as we refer to as PRA. The 811 Capital Advance Program provides funding for the direct development in the operating costs in form of a rental assistance to create new units. The PRA is a rental assistance only component of the 811 program. I will discuss the differences between the two programs in a little bit more detail in the upcoming slides. Next slide. So here we have the snapshot of the 811 portfolio, how many properties we have funded over the years since 1990 for the 811 Capital Advance Program, and for the Section 811 PRA program, the program came into fruition in 2012. So currently, as it stands, we have over 3,500 properties that represent over 35,000 units. Most of these are scattered across the country. For the PRA program, we have awarded 39 awards since 2012. Next slide. As I previously mentioned, the Capital Advance Program provides funding to the development of new units. HUD provides the cost for the construction and the rehabilitation of new 811 units. HUD also provides the long-term operating costs of the property in form of rental assistance to maintain the ongoing affordability of the property for 40 years. These funds are provided to private nonprofit organizations who will develop and operate the 811 properties. These funds are competitive and issued through a notice of funding and opportunities. Next slide. The PRA program varies a little different from the Capital Advance programs, as these funds are provided to state housing agency who distributes the rental assistance to properties throughout the state to provide permanent supportive housing for 20 years. The program requires state housing agencies to collaborate with their state health and human service or Medicaid agencies. This program targets extremely low-income persons with disabilities. In addition, the state housing agencies and partnered with their state health and human service agency may target homeless or at risk of homeless populations, persons living in institutions such as nursing homes, or states that in years past had homestead settlement agreements. These funds are also competitive and issued through a notice of funding opportunities. Next slide. So who are our residents of the 811 for the Capital Advance and for the PRA PRA program? That means a household composed of one or more persons who is 18 years of older and less than 62 years of age who has a disability. A person who shall be considered a disability if they have such determined by a physical, mental, or emotional impairment, which is expected to be long and continued, indefinite in duration, either substantially impedes his or her ability to live independently, and is such of a nature that the ability could be improved by more suitable housing conditions. So most people want to know, next slide. So how do you access these 811 programs? Outside of being a person with a disability or a household comprised of persons with disability, another requirement under the 811 programs would meet the income requirement. The Capital Advance targets very low income, which means they're below 50% of the area median income. PRA tries to target extremely low income persons with disability, which means their income is below 30% below the area median income. So another question I get through a lot of people is, so how do you apply for these programs? For the 811 Capital Advance properties, this assistance is available directly at the properties. So for 811 PRA, you have to contact your state housing agency that has received a PRA grant for more assistance. Next slide. So now that we have the housing, so how do you connect to the services? For the Capital Advance, the nonprofit sponsor is required to provide a supportive service plan when they're applying for the notice of funding opportunities with their application that addresses how the services will be offered or made available. This plan must be tailored for the population the housing is expected to serve. They must use a person-centered approach. They have to align with their state locals' approach to expanding community living and opportunities for persons with disability. They must document the implementation and strategies for outreach, referrals, communication, transition services, and tenancy supports. And they also have to outline their partnerships and coordination of services with their local service providers. Next slide. For the 811 PRA program, the state housing agency must provide an interagency partnership agreement with their Health and Human Service Agency with their application when applying to the notice of funding opportunity that addresses how services will be available to residents in the PRA program. And part of that partnership agreement, they must, provide their methods for outreach and referral, which descriptions of the target population they will be trying to target under the program, a commitment to the appropriate services, and how the state will administer these services and how these services will be available to residents. Next slide. So here are some helpful resources to how to access, the 811 capital advance. So HUD has a resource locator, which will give you the property address. Another best available resources is contacting our multifamily regional centers and satellite offices. We have regional centers that represent, the different regions throughout. We have 5 regions, and they represent the various states within those regions. And you can reach out to them to get more information on a list of the 811 capital advance properties. For the 811 PRA properties, you can, as my previous HUD colleagues mentioned, is the HUD Exchange. And on there, we have a link to the PRA program grantees. Those are the state housing agencies that received a grant throughout the years for the PRA program. And next, we're going to actually hear from one of our grantees, is the state of Arizona, and I'm going to turn it over to Megan.
Thank you, Katina. Next slide. Hi, I'm Megan Akins with the Division of Developmental Disabilities, a division within the Department of Economic Security, whose mission is making Arizona stronger by helping Arizonans reach their potential through temporary assistance for those in need and care for the vulnerable. DES's true north is all Arizonans who qualify receive timely DES services and achieve their potential. Next slide. The Division of Developmental Disabilities is a state agency within DES whose mission statement is to empower individuals with developmental disabilities to lead self-directed, healthy, and meaningful lives. Next slide. DDD provides services to qualified members who are 6 years of age and older who have a qualifying diagnosis of autism, cerebral palsy, epilepsy, intellectual cognitive disability, and Down syndrome. Children under the age of 6 years need to be at risk for or diagnosed with one of the qualifying diagnoses. Next slide. This slide shows a breakdown of DDD members by their primary diagnosis. As you can see, the highest categories are intellectual cognitive disability, autism, and children under the age of 6 who are at risk for one of the 5 qualifying diagnoses. Down syndrome was added as a qualifying diagnosis in the last legislative session, and at this time there are 45 members with a primary diagnosis of Down syndrome. Next slide. In addition to the qualifying diagnosis, in order to be determined eligible for DDD, the applicant must have substantial functional limitations in 3 or more of 7 major life areas. These include self-care, receptive and expressive language, learning, next slide, mobility, self-direction, and for those 18 years of age or older, capacity for independent living and economic self-sufficiency. Next slide. Once someone is determined eligible for DDD, they will fall into one of 3 categories. DD only are members who are not Medicaid eligible and receive case management through support coordinator, who helps connect the member and family to community resources. Targeted support coordination is for members who are determined eligible by Access, the Arizona State Medicaid Agency. These members are financially eligible for Access Health Plan, in which they receive physical health and behavioral health care through Access contracted health plans. These members also receive support coordination, who connects the members and families to community resources. Long-term care are members who are both financially and medically eligible for the Arizona long-term care system and receive DDD health plan that provides physical and behavioral health services. They are also eligible for long-term care services and supports which includes home and community-based services based upon their assessed need and medical necessity. All DDD members have case management through support coordination. DDD membership is inclusive of 4,814 DD-only members. Next slide. 6,248 targeted support coordination members and 40,068 Arizona long-term care system members. Next slide. This graph shows where DDD members live. 90% of members live in their own home or family home. 7%, just over 3,500 members, live in a group home. 3%, approximately 1,500 members, live in developmental homes. There are 104 members who live in intermediate care facilities or nursing facilities. 18 members live in assisted living centers or homes, and 4 members are currently residing in behavioral health and residential facilities. Our group homes and developmental homes are community-based, and group homes generally have 3 to 4 members, and developmental homes between 1 and 3 members. Next slide. This slide and the next slide come from the Out of Reach report, which is published by the National Low Income Housing Coalition. This research shows that for a 2-bedroom in Arizona, it was determined that fair market rent is $1,219 per month, and a person working minimum wage would need to work around 60 hours per week to afford this. Next slide. That same research indicates a person receiving supplemental security income, SSI, can afford to pay $252 a month for rent. Next slide. Affordable housing is designed to bridge the gap between what a household can afford and the actual cost of rent. This is why affordable housing makes such a difference for our members. Next slide. These are the affordable housing opportunities available to DDD members. The first is the 811 Project Rental Assistance Program that Katina spoke about earlier. The second is the Kofelt-Lamoureux Apartment Homes. And the last 2 are voucher programs with the Housing Authority of Maricopa County and the City of Tucson. To note, the Housing Authority of Maricopa County opportunities came from beginning the partnership due to the 811 program and fostered 42 additional subsidies for our members. For each of these opportunities, members pay 30% of their total household income for rent. Each DDD opportunity provides preference to DDD members, which means the division refers members directly to the opportunity instead of referring them to a public wait list. Next slide. This beautiful property is one of our most sought after 811 properties. It's in the heart of downtown Phoenix, right by public transportation. Next slide. The 811 Project Rental Assistance Program is a grant from HUD to the Arizona Department of Housing with the Arizona Healthcare Cost Containment System, the Arizona Department of Health Services, and the Division of Developmental Disabilities as partners. In fiscal year 13, HUD awarded the Arizona Department of Housing $2.94 million that covers 55 subsidies for DDD members. In fiscal year 19, HUD awarded the Arizona Department of Housing a little over $3 million that will cover approximately 50 subsidies for DDD members. Next slide. This is Kofelt, which was provided as leverage or match for the fiscal year 13 811 Project Rental Assistance Grant. Division members were given preference to 30 units in the tenant selection plan for this property. These units were a great start to practice for the 811 units that were coming. Next slide. Vouchers are set aside for DDD referrals. DDD collects all documents and submits a complete referral packet to the housing authorities. The individual must be DDD eligible. The Housing Authority of Maricopa County, or HAMC, offers DDD members mainstream vouchers, and the City of Tucson offers DDD members non-elderly disabled, or NED vouchers. With both of these voucher programs, the member locates their own housing and works with the Housing Authority to obtain the approval. Next slide. Across the top of this chart are the different housing opportunities and their requirements. For example, Kofelt-Lamoureux and 811 PRA units require the DDD member to be All-Tex eligible, or Arizona Long-Term Care System eligible, but the vouchers are available for any DDD member between the ages of 18 and 62. A referral from their support coordinator or case manager is required, as well as a current person-centered service plan that identifies independent living goals. Next slide. There are a total of 93 members currently taking advantage of our programs. Next slide. This slide talks about what a typical wait looks like. At any given time, there are around 100 members on our 811 or COFELT wait list. The longest wait has been a little over 2.5 years, where the member had lots of preferences and preferred to wait for a specific property. The shortest wait from referral to move-in was 7 days, and the average wait time from referral to move-in is approximately 7 months. Next slide. From April 2017 to April 2023, the division has saved more than $2.5 million in service costs by 11 members moving from group homes and developmental homes into COFELT and 811 units. This illustrates the difference in paying an hourly versus a daily rate of home and community-based services. Next slide. How can DDD partner with housing providers, public housing authorities, and community housing agencies? We maintain our own current wait lists for programs and can refer members off our wait list directly to vacant opportunities. DDD can write letters of support. We can provide eligible DDD members with in-home services and case management, and we can announce public waitlist openings to our case managers. Next slide. DDD members don't typically access housing in the same way that the member of the public would. Their vulnerability and functional limitations create barriers to accessing coordinated entry and shelter systems. This makes creating innovative partnerships and connecting with public housing authorities, continuums of care, and housing providers imperative. DDD and other managed care organizations in Arizona participate in homeless systems and activities such as the local coalitions to end homelessness, continuums of care, and the homeless management information systems. These entities connect people who are homeless and the agencies who serve them to housing opportunities. Next slide. This is Sarah. She lives in one of our 811 PRA properties right off the public transportation. She goes to a day program and she receives habilitation to help her live independently. Next slide. This is Angie. Angie lives with her brother who helps her budget and pay her bills. Next slide. Now you've heard and seen about our successes in our programs and our partnerships. Anderson Moore, a DDD member, has agreed to speak with us today and talk about how these programs have enhanced his life. Welcome, Anderson. Thank you to agreeing to talk with everyone.
Hi.
So tell me about your transition out of foster care.
Well, I guess we should start where it began. When I was aging out of foster care, my team asked me if I wanted to enroll in an adult program or go out on my own. I made the choice of enrolling in the adult program at first. I went to adult foster homes, then group homes. I was homeless for like 3 months and was not on my meds for at that time.
What skills did you have to work on to move out on your own?
I had to learn many skills to be on my own. Some of the skills I had to work on included cooking, dishes, keeping a schedule, money management, and taking my medication. By working on these goals, I was able to begin the journey of being on my own.
What was the application process like for your apartment? Anderson, you're getting hearts.
Oh.
You see those?
Sorry, speech impediment. Because they knew about my autism, they helped me through the application process. My case manager referred me to the list and helped me submit my documentations.
What do you like about living on your own?
I get to do my own thing, no curfew, and spend my own time reading books. I have too many books.
What's your favorite?
The Road.
How do you give back to your community and what activities do you participate in?
I participate in our neighborhood food bank that we actually have in the COFELT complex. The community events like the Christmas events. Decorate for the holidays, give out candy, welcome new neighbors. Actually, when I decorate for the holidays, Halloween, I go all out.
I'm sure your neighborhood appreciates that. I personally have seen the decorations and they are great. Can you tell me about the community that you live in?
It's more peaceful here than you would think. Ever since the rebuild has been, this has been a community like a family.
And what things have you learned and improved upon as yourself as a person?
How to be a good neighbor, keeping up with taking my medication, alarm on my phone to keep up with daily tasks. Consistently having providers and relationship building, problem solving, learning how to advocate for myself.
You're doing great. What do you think, where do you think you would live if you didn't have this opportunity?
Well, I would probably either be dead, wouldn't have a home, I wouldn't be able to schedule to take my medication, and I'd have manic episodes and whatnot, wouldn't have made it.
And I almost cry every time you tell me that. You are doing great. You have all these emojis popping up. Anderson, can you see all these hearts on your screen? Everybody's loving you. Do you want to, and we have claps and some confetti cannons. Yeah, whoa, lots of stuff. Can you see all this?
Yes.
Okay. And somebody likes your book. But Anderson has agreed to show us his apartment. Are you still up for that?
Yeah.
All right, let's see.
Where's that? Here. Okay, can you see it?
Yep.
Okay, so we'll start with the outside area, just get that over with. So on the outside, every apartment here has a little patio. I designed it in a way where I grow little plants during the summer for vegetables and stuff. All right, and then when you come in here, you have the little area where I put my stuff that I go out when I go out in public. The headphones are supposed to be there. I don't know why they're not there. And then right here, we have the living room / library. I'll save the best for last. And then over here, we have the kitchen, my mode of transportation. Every unit actually comes with a laundry unit. Sorry for the mess in here. And then the bathroom's actually pretty spacious. It's a pretty spacious bathroom. Oop. And then the best for last, which is something I'm currently proud of myself for actually building, is a little game room / bedroom / movie theater.
Oh my, very cool. Okay, you have lots of comments. It says, thanks for sharing your home and your story, Anderson. Way to go. This is very cool. I love the live interaction. And you got another love it. And still the emojis are coming. They like the library. And they want to know if you're a live gamer. Best meeting ever, they said.
I did create a Twitch channel. I don't remember the exact name of it right now, but I did actually start a Twitch channel. And
they said everything looks like you are having fun in your home. All right. Thank you, Anderson. You did awesome. And can I get the next slide, please? And actually on that slide that you guys just looked at, that is where Anderson lives. You can see those pictures. It's really beautiful. But thank you for sharing your experiences in your home, Anderson. And this concludes Arizona's presentation. The first link on this slide is to our affordable housing webpage. And the second is an email address and phone number if anyone wants to reach out with questions. And I will turn it over to Erica. Thank you all.
Thank you, Megan. And we really only have time for about one or two questions. But I did want to point to the fact that In the slides, which you all will be receiving, there are links for you to ask questions on the separate presentations. And also we have the HSRC box too. So if we don't have time today, which we won't, because you all have a lot of questions, that's the way you can submit your questions and get an answer. But I did want to throw this out to the panel because this is something that comes up when it comes to housing and people with IDD. And that is one of the members said if they don't have, if a person doesn't have any documentation, no records, they don't qualify for SSI and have no income, how can they're trying to get them into housing. So this person has mental health, substance abuse disorders, and they're experiencing homeless. They don't have family available. Is there a way to help them and to get support? But they have a developmental disability as well, but they're not in the system. And we've heard that before. So I don't know if there's been any creative solutions for how individuals that aren't in the system that might have a DD and other substance use or things like that can get access. Does anybody on the panel have a response or know where they can start?
Hey, Erica, this is Lisa from HUD. I'll take a portion of that. So for the homeless assistance programs, the only time that an individual would need to document a disability is if they are applying for a program that is permanent supportive housing, because permanent supportive housing does require that you are a person with a disability that is experiencing homelessness. So if an individual was applying for PSH, they would need to be able to document their disability. Now, in terms of, we have seen local programs and COCs be incredibly creative in terms of obtaining that disability documentation through local providers, through Centers for Behavioral Health, through Centers for Independent Living. So we could definitely work with an agency to see what type of documentation they can put forward. But once again, I should stress that folks are only required to document disability for permanent supportive housing. Now, if a person with IDD was homeless and was applying for a homeless program that was not permanent supportive housing, they would not have to document disability. They are eligible just because they are a person who is experiencing homelessness. So I hope that answers the question, at least from the purview of HUD's homeless assistance programs.
Thank you, Lisa. I appreciate that. And I know that we have only a few minutes, and I believe that we need to turn this over to Lori to basically give you all a call to action too. So Lori, are you available? Thank you.
I am. Thank you, Erica. And a big thank you to our expert presenters, and especially to Anderson for showing us his wonderful home. He's got a lot of features in there. I was thinking, wow, that theater room looks pretty exciting. We've learned so much from all of you in a very short period of time, probably more. We have more information than we can all take in, but these slides, the recording, and resources that have been mentioned will be posted on the HSRC website. So I encourage you all to visit that site. Our previous webinar is also posted there on the What's New page under prior events and webinars. So please visit that page. There's other webinars we offer that could also provide some additional helpful information. We will take the questions we've received and see if we can develop frequently asked questions and respond to some of the questions that you've shared with us that we didn't get a chance to get to today. We hope that you've gained an initial understanding of the array of resources and programs we can braid together to increase the availability of successful housing options for people with intellectual and developmental disabilities. And we really believe that together we can turn these resources and the experiences shared by Megan and Anderson into action. This is a great example that they shared with us today. Some of you are already leveraging these resources and or have found additional resources and also have successful housing options. And we'd like to learn more about your partnerships, strategies, innovations, and these options that you're creating. Please email us at the hsrc@acl.hhs.gov with your stories. Peer-to-peer learning is so powerful, as you just heard and saw, and we really believe that's the way we'll be able to advance our work and make it more available in a broader array across the country. So in the body of that email, please include a brief description of how you are turning resources into action to increase housing options, who your partners might be, the resources you're using, and the best way to contact you. We really want to hear about what you're doing out there, and we love to shine some bright lights on these examples. If we go to the next slide. Finally, we want to thank today's speakers, our ACL and Administration on Disability colleagues, our Housing and Services Resource Center colleagues, the ACL housing team, the team at CITEM that produced today's webinar, Caroline and Deborah, our ASL interpreters. I really want to give a shout out again to Anderson for sharing his experience in his home with us, and Megan for telling us how we can make this happen. We're especially grateful for all of you. The chat's been really busy. The Q&A is busy. We really appreciate your sharing, your questions, and your participation and joining us for today's webinar. Thank you and have a great afternoon.